And I'm back. We got something to drink, so hopefully I can make it through the rest of this chapter without my voice completely dying on me. So, practical matters involved in microbial control, uh, critical medical devices. These are things that, again, they are critical, such as ventilators and those types of things. They're expected to become in contact with sterile tissues. Therefore, they must be sterilized before use. Again, something that's going to go down in a patient's throat, a ventilator, a catheter, those types of things. Again, surgical instruments, you expect those to be sterilized. Semi-critical devices come in contact with mucosal membranes. These receive high-level disinfection, preferably sterilized. Again, there are lots of patients out there who are have to perform home catheterization. They have some sort of urinary tract issue where they have to insert and remove their own catheters on a daily basis. Those typically receive high-level disinfection. Again, much better if those patients are able to use ones that are sterilized, but in certain instances, that's just not practical. Again, these things will receive this high-level disinfection, but those patients do have a pretty high rate of urinary tract infections. Non-critical devices either do not touch the patient or only touch the intact skin. These require low-level disinfections unless they become contaminated with blood or body fluids. So something, again, a non-critical device would be something like a pulse oximeter that you would stick on the end of your finger, or a blood pressure cuff. Substances that require sterilization, durable solids to sensitive liquids, and we'll talk about how we handle different things when we come to needing them to be sterilized. The situation requires sterilization. Confront persons involved in healthcare. If you've ever been in a hospital in an ICU ward, you may see a nurse in a full, scrubs with fully dressed to go into a sterile situation. In movies, you see this, where the folks wear the suits that look sort of like space suits going into a situation. There are no universal methods that work well in every case. Basically, every case of sterilization has to be pretty much tailored to the situation you're dealing with. Cost is a consideration for sterilization. Again, back to this one right here. Again, better if these patients have everything sterilized, but it is cost prohibitive, so many times they just receive that. The effectiveness of sterilization. And how are you going to dispose of the product? Again, these patients who have the urinary tract issues and have to catheterize themselves every day, if they're using a different sterile catheter every day, sometimes maybe 2 or 3 times a day, how are they going to get rid of all of those? Those things are going to really, really build up. Medical waste is something that can and oftentimes does become a problem. What exactly do we mean by microbial death? Now, we talked about growing bacteria earlier, and we talked about when we talk about growing them, we don't really concern ourselves with the concept of the bacteria getting bigger. We talk about the number in the colony increasing. So what we talk about with death. Death is the permanent termination of an organism's vital processes. Microbes have no conspicuous vital processes, therefore death is difficult to determine. We pretty much know when the apple tree in your front yard has died. We know when your dog has died. We know when your grandparents have died. But microbes, it's a little bit more difficult to determine, well, is it dead or is it in just some sort of stage of suspended animation? But for bacteria, the permanent loss of reproductive capability, even under optimum growth conditions, has become the accepted microbial definition of death. So permanent loss of reproductive capability, even under optimum growth conditions. You take a sample, is that culture of bacteria in that bottle dead? If you take a sample out of it, put it into a growth medium that you know that bacteria can grow in, you put that growth medium into an incubator at the optimum temperature for that bacteria to grow, and after 24 hours you don't have any growth, then that culture is dead. Death begins when a certain threshold of microbial agent is met. Again, the whole population. Death continues in a logarithmic manner as the time or concentration is increased. Active cells tend to die more quickly than less metabolically active cells. And eventually a point is reached at which the survival of any cells is highly unlikely. At this point, it is equivalent to sterilization. So it begins when a certain number of those agents have died, the death rate. That death rate will then continue in a logarithmic manner. You'll remember our idea from a few chapters ago about that standard bacterial growth curve, and you saw the death phase where the number started to fall rather rapidly. That's the logarithmic manner. What are factors that influence the action of antimicrobial agents? How many bacteria are there? If there are a lot, it is going to take you longer to destroy them. I mean, that makes perfect sense. If you have one ant on your countertop, smash, you killed one ant. If you have 1,000 ants on your countertop, it's going to take you a good little while to get rid of those. So higher loads of microbes takes longer to destroy. What is it about those organisms? Do they have some special characteristic that makes them more resistant? Could it be that the population is a mixture of bacteria, funguses, spores, and viruses, all of which have different spectrums of resistance? Therefore, maybe you can get rid of all the bacteria in 10 minutes, but it takes 30 minutes to get rid of all the fungi and 2 hours to get rid of all the spores, but 5 minutes to get rid of all the viruses. So the amount of time and the rate included is going to be, or the number of organisms included is going to affect the rate. You also can be affected by the temperature and the pH of the environment. We'll talk a lot about temperature in just a couple of minutes. The concentration or dose of the agent. UV radiation, for instance, is most effective at 260 nanometers. Most disinfectants are more active at higher concentrations. However, with almost all of these disinfectants, there is a point at which more is not better. A 2% solution may be better than a 1%, and a 5% may be better than 2%, but 10% may not necessarily be any better than 5. If there's a point where more is not necessarily better. How does the agent work? What is it that the agent does to the microbe that causes the microbe to no longer be able to function? Or how does it kill or inhibit the microbe? And we'll talk about modes here in just a few minutes. The presence of certain solvents or some organic matter or some inhibitor may play a role. Saliva, blood, fecal matter can inhibit the actions of disinfectants or even heat. You will sometimes read on certain disinfectants, that they should not be used on bodily fluids. The reason they shouldn't be used on bodily fluids is these bodily fluids are probably going to eliminate the capability of these particular agents from working. It's going to make them less effective. Antimicrobials have a range of cellular targets. What part of the cell are they going after? The least selective agents tend to be effective against the widest range of microbes, heat and radiation. Selective agents tend to target only a singular component, drug. So if you're using heat or steam or radiation, you're wiping out pretty much everything that's there. If you are giving a drug, you are only giving, and go back here to where this mixture, if you're giving a drug, you're probably only targeting one or maybe two things in that mixture. Components of the cell can also be the targets of both physical and chemical agents. The cell wall can be affected. Many of our antibiotics, penicillin for instance, is a cell wall inhibitor. It prevents the bacteria from making new cell walls. No new cell walls, no new cells, no new cells, no reproduction. Maybe it affects the cytoplasmic membrane. We refer to these as membrane disruptors. And same thing, if the cell cannot make new membranes, then it cannot make a new cell. Cellular synthetic processes, maybe it interrupts the DNA formation or RNA formation. Possibly it disrupts proteins. Remember, enzymes are proteins. Microbes require enzymes to function. If they can't make new proteins, they can't make new enzymes, therefore no reproduction. Various cell structures, talking about the target. Here's the cell wall targets. Here's what the effects the agents can do. It can either destroy the cell wall or it can block the synthesis of the cell wall. And the example agents out here are chemicals such as our drugs, detergents, and alcohol. Cytoplasmic membrane destruction or membrane function, detergents and alcohol will be effective. Cellular synthesis, there's our old buddy formaldehyde from A&P lab. Those of you who have taken A&P and know that horrible, awful smell. But formaldehyde, the reason it breaks down in organic tissues, doesn't rot and spoil in the formaldehyde solutions, is because it disrupts cellular synthesis. Just prevents new cells from being made. Therefore, the bacteria that may be on that dead, whatever you're putting into the formaldehyde, the bacteria can't reproduce. Protein synthesis, again, moist heat, alcohol, phenolics. We'll talk some more about phenolics a little bit later. During COVID-19, alcohol-based hand sanitizers are a mainstay of disinfection of surfaces and antisepsis of hands during the COVID-19 pandemic. If anybody, unless you've been living under a tree somewhere, under a rock somewhere, or in a tree, you know that for almost a year, we used sanitizer on our hands constantly. We wipe down surfaces. There's still, in this room there's still a box of K95 masks, and there's a bottle of hand sanitizer, and I don't see a tub of wipes, but if I requested one, there would still be one brought to me. SARS-CoV-2 is an enveloped virus. Its envelope is susceptible to both detergents and alcohol. That's why the alcohol-based hand sanitizers seem to be very effective against the spread of this disease. The oldest method we have of eliminating microbes is heat. Elevated temperatures are microbicidal. Low temperatures are microbistatic. Here's what I have always told students. If you remember this about heat, it will carry you a long way. Heat kills, cold preserves. Those of us who have done microbiological research have used what is called a super cold freezer to store our microbial samples at a very low temperature. All you have to do to revitalize and start growing those bacteria again is take them out of the freezer and start them over, and they will start growing very effectively. So heat kills, cold preserves. A moist heat, such as hot water, boiling water, or steam, anything between 60 degrees Celsius and 135 degrees Celsius are effective antimicrobial agents. A dry heat, such as hot air or an open flame. A flame can range from 160 degrees with hot air to several thousand degrees using an open flame. But moist heat versus dry heat. Moist heat uses lower temperatures and shorter exposure times to achieve the same effects as dry heat. The microbial effects for moist heat is the coagulation and denaturation of proteins. Coagulation means the proteins all clump together. Denaturation means individual proteins have lost their shape, their characteristic useful shape. Dry heat dehydrates the cell, which removes water necessary for metabolic functions. Dry heat also denatures proteins. If you've ever fried a piece of chicken or barbecued steak, that's using dry heat to denature the protein. Increases the stability of some protein conformations, but that requires very much higher temperature. At very high temperatures, cells oxidize, burning them to ashes. That's what happens on your little loop when you pick up the bacteria. You put a sample somewhere, and then you stick it in the flame, and then there's that little gunk on the end of your loop that you can actually then touch to a paper towel or something, and you see it leave a mark behind. That's the oxidized remains of the leftover cells. Here's how heat works. Here's a normal protein. Here's the substrate. The substrate can, this is the native state, excuse me. I'm sorry, I misinterpreted. Here you see where the substrate is supposed to attach here and here. Here, complete denaturation. The protein has completely lost its conformation, therefore the substrate has no place to attach. A different shape, again, the agent, while it has not completely denatured, it has changed it enough where still this active site here is no longer functional. The one that is supposed to be binding right there can't get there either. Or you can have the microbial agents block the active sites so the substrate cannot attach themselves. 3 different types of heat and chemical. These two would more than likely be applied by heat, and this is the chemical process. Temperatures that needed and time. This is actually really, really interesting. If you look at 121 degrees and the time to sterilize something in minutes, a moist heat, 121 degrees, takes 15 minutes. A dry heat at 121 degrees Celsius takes 10 hours or 600 minutes. If you go up to 134 degrees, moist heat only takes 3 minutes, but an equivalent temperature of approximately 140 degrees dry heat means 3 hours. So it's 3 minutes versus 3 hours. So moist heat, lower temperature, shorter time. Dry heat, higher temperatures, longer times. And if you're using compatible temperatures, such as, again, this 121 degrees, extreme difference in the time required. Things that are heat resistant. And what is the thermal death point? Endospores versus vegetative cells. Well, for bacterial endospores, they show the greatest resistance to heat. The destruction of these spores requires temperatures above boiling. That's why the process of making and canning foods that human beings have done for a couple of hundred years can be very tricky. My mother used to can vegetables all summer long. We planted green beans and corn and all sorts of other things that my mother would can. And my mother used glass jars and the old method of canning things. The problem is that endospores of certain bacteria are not destroyed in that process. They are put into sort of a suspended animation where they're not actively growing. And if you seal your jars correctly, there's no oxygen in there, then the spores of oxygen bacteria can't grow. So while the spores are still in those jars, they can't actively grow to cause spoilage to the green beans, for instance. But if your sealing method is not accurate or not complete, and some oxygen is allowed to get in there, then those spores can grow and your green beans will go bad. That is because the endospores are not destroyed through the boiling and canning process. Vegetative cells are going to vary in their sensitivity to heat. Death can vary from 50 degrees Celsius for 3 minutes to 60 degrees Celsius for 60 minutes, just depending on the different type of cell you are dealing with. When my mother boiled, so that's 100 degrees Celsius. As I recall, she brought them up to temperature and held them there for 10 or 15 minutes in the pressure cooker. That killed all the vegetative cells, but it left the endospores behind. And again, as long as the sealing of the jars was sufficient, those endospores could not grow. The vegetative cells of endospore formers are just as susceptible to heat as vegetative cells of non-endospore formers. Pathogens are neither more or less susceptible to non-pathogens. Fungi, protozoans, and worms are similar in their sensitivity to heat. And viruses are sensitive to heat. However, their tolerance extends from 55 degrees Celsius for 2 to 5 minutes to 60 degrees Celsius for 60 minutes. Again, on all of these, do not overly concern yourselves with exact temperatures and time ranges. Just understand that temperatures and time limits are often linked. Short temperature, long time. Long temperature, short time. Or low temperature, long time. There's high temperature, short time. The thermal death time is the shortest length of time required to kill all test microbes at a specific temperature. The thermal death point is the lowest temperature required to kill all the microbes in a sample in 10 minutes. Thermal death time and thermal death points are rarely the same. The thermal death point is usually significantly higher than the thermal death time. So why would we not want to autoclave everything at the thermal death point? Could possibly be that whatever you are treating is, again, perishable. It would then deal with the product being damaged. It could be that you're using a piece of durable medical equipment, and the thermal death time using it requires a lower temperature. Therefore, we use the lower temperature because we're using a specific temperature here. So you have a lower temperature, therefore you can let it be at a longer time, but you're not damaging that piece of durable medical equipment, whereby if you raise it to this temperature, you may damage that piece of equipment. You may be dealing with a food product that those extremely high temperatures would cause a texture issue or a taste issue. Moist heat, boiling water. A simple boiling water bath can quickly decontaminate items in the clinic or at home. Again, the big problem here is the greatest disadvantage with this method is that items can easily be recontaminated when they are removed from the water. Basically, when you take them out of the water and lay them down on a surface to get to a point where you can handle them, they are recontaminated. My mother, for instance, again, when she was canning, she would put the little lids and the rings for her mason jars in a boiling water bath. She would also boil the jars, again, to help sterilize them. But again, very easily recontaminated. Pasteurization is used for disinfecting beverages. Again, most people think that Louis Pasteur developed, invented, whatever you want to say he did through the process of pasteurization for milk. Actually, he did it for beer and wine. But it was very quickly discovered that the process he developed for beer and wine could also be used for things like milk and fruit juices and make them last longer. Pasteurization is a technique in which heat is applied to liquids to kill potential agents of infection and spoilage, while at the same time retaining the liquid's flavor and nutritional value. Again, there is a very close range when it comes to pasteurizing milk. Uh, there's a very few degrees between pasteurizing milk and curdling the milk. So you have to, again, that's a process that's very meticulous. From what I understand from my friends who do some home brewing, the temperature between a pasteurized beer that tastes like it's supposed to and a pasteurized beer that tastes awful is simply a very few degrees. You can easily mess that up. Autoclaving, I'm not going to sit here and go through all of the major points of an autoclave, but this is a typical small autoclave. Each one of these trays will contain something that needs to be sterilized. This looks similar to the one that you will see in most dental offices, possibly small doctor's clinic where he may do some surgery like, wart removal, mole removal, those kinds of things. But what you will do is you will close this door. You see the red circle, that is a seal. You close the door. This is the lock that locks the chamber down. You will then, using steam, raise both the temperature and the pressure inside that chamber. The thing you will learn in your chemistry class is as you increase the pressure, you also increase the boiling point of the water. If you use a boiling water bath, you have to constantly add water to your boiling water bath because water boils away. But by using this sealed chamber, you don't lose any water. Therefore, you can raise the temperature to where you can get the water does not boil at 121 degrees. Again, not going to ask you to remember that at a pressure of 20 psi, which is 5 psi above normal, the temperature of steam is 109 degrees. As the pressures increase, blah, blah, blah. At 15 psi above normal, a total of 2 atmospheres, steam will be 121 degrees. Normally, steam would be about 100 degrees Celsius. So it's not the pressure. It's not the pressure by itself that kills the microbes, but the increase in temperature the pressure produces. And an autoclave generally has some issues. It's ineffective for sterilizing substances that repel moisture like oils and waxes, or for those that are harmed by it, such as powders. Another item that you have to be very, 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 very careful about is plastics. Glassware, cloth, medical instruments or metallic instruments, liquids, paper, some certain medias, heat-resistant plastics. You have to be very careful when you are putting things in the autoclave to make sure they are autoclavable. I have in my life put things in the autoclave and wound up with a big gob of plastic at the end because what I thought was an autoclavable plastic flask was not. Dry heat, incineration versus a hot air oven. A dry heat is a flame, as an example. Flame of a Bunsen burner reaches about 1870 degrees Celsius. Furnaces and incinerators operate at temperatures between 800 and 6500 degrees Celsius. Direct exposure to such intense heat ignites and reduces microbes and other substances to ash and gas. Hot air ovens, on the other hand, provide a means of dry heat sterilization. The dry oven, which is usually an electric or occasionally gas, have coils that radiate heat within an enclosed compartment. Think about your oven at home, your cook stove, the oven on your cook stove. That is an example of a hot air oven. Heated and circulated air transfers its heat to the materials in the oven. Sterilization requires a longer amount of time than incineration does, but it ensures objects' thorough heating and destruction of endospores. So there's an example of somebody's flaming their loop in the flame of a Bunsen burner. And again, here is an example of a hot air oven. The giant autoclave I used when I was at UALR is about that big. It actually was a combo autoclave. It could be a steam autoclave, or just by flipping a switch, it became a hot air oven. It actually had both processes. The principal benefit of cold treatment is to slow the growth of cultures and microbes in foods during process and storage. Again, cold merely retards the activities of most microbes. Cold preserves. Most microbes are not adversely affected by gradual cooling, long-term refrigeration, or even deep freezing. Your typical home freezer is going to be, when you got your ice cream in there, it's generally going to be between 20 and 30 degrees below 0 Celsius. Super cold freezers in microbiology labs may be 70 degrees to 135 degrees below 0 Celsius. But again, those can preserve cultures for extremely long periods of time. When I was, again, doing some of my work at UALR, I reanimated some of Dr. Bush's Dictyostelium discoideum cultures that were like 17 years old. And I took a sample of those and reanimated them and made actively growing organisms. Desiccation is where the vegetative cells have been exposed to normal room temperature gradually and will become dehydrated. Some microbes are killed by desiccation. Many others are not killed. Some are even preserved. If you've ever had a potato that's fallen around the back of the cabinet or something, and you found it, it's all shriveled and shrunk up, that is the desiccation process. Lyophilization is a combination of freezing and drying. If you have ever seen freeze-dried coffee, for instance, not a coffee drinker, don't know whether freeze-dried coffee is still a thing now that the world of Starbucks, but there used to be a thing called instant coffee that was freeze-dried. You could just take a spoonful of that, put it into a mug of hot water, stir it a little bit, and you had coffee. Now, my friends who are coffee drinkers say that's really not coffee, but okay. But that coffee was freeze-dried. Freeze-drying is a method of preserving microorganisms in a viable state for many years. Pure cultures are frozen instantaneously and exposed to a vacuum that removes all the water, avoiding the formation of ice crystals. When I get these in lab, these freeze-dried cultures, they look like little gray, sort of, well, not really gray, sort of a beige pellet. And you drop that into the water, into a suitable liquid medium, and they almost instantly dissolve. And within just a very few hours, you've got actively growing bacteria. Radiation, energy emitted from certain atomic activities and dispersed at high velocity space. Gamma rays, X-rays, ultraviolet radiation. As we move here, this is the wavelength of light. As you move, this is considered to be longer. As the distance between these peaks and valleys becomes greater, those things are said to have a longer wavelength. Gamma rays are way down here. X-rays are here. Here is ultraviolet radiation. Ionizing radiation, such as gamma rays and X-rays, are highly effective. They are a highly effective alternative to sterilizing materials that are sensitive to heat and chemicals. The devices that emit these rays include gamma ray machines, X-ray machines, cathode ray machines. These items are placed in machines and irradiated for a short time with a very carefully chosen dosage. Ultraviolet light, again, I won't ask you to remember that ultraviolet ranges from 100 to 400 nanometers. It is at its most lethal at 240 to 280 nanometers. So if you've ever been to a tanning parlor and the tanning parlor tells you we use the safe UV, there's no such thing as safe UV. It's just that UV ranges outside of this area right here are safer than others. UV radiation has a very low energy state, so it doesn't penetrate like ionizing radiation. UV radiation passes readily through the air, but slightly through liquids and poorly through solids. So generally things that can be sterilized or disinfected by UV, it's going to be surface things. Filtration is an effective method. Filtration doesn't kill microbes. It doesn't make them static. It simply removes them from air and liquid. A fluid is strained through a filter with openings large enough for the fluid to pass, but too small for the microbes to pass. One of the issues that was never made clear to the general public was in the COVID world, the cloth masks that we were all wearing are relatively ineffective at preventing viruses from exiting the body. The value of you wearing a mask and me wearing a mask was that while the virus may leave your body and get out of your mask, the what's the word I'm looking for here? The likelihood that that virus would leave and pass through your mask and then pass through my mask and get into my body is very remote. So one person wearing a mask was good. Two people wearing a mask was better. But nobody wearing a mask of those cloth type masks that so many of us were wearing, those were never going to be perfectly efficient. If you were wearing a K95 or a KN95 and I was wearing a KN95, the likelihood of us passing that from one to the other in an elevator would have been much less likely than if you were wearing a cloth mask that had, the Harry Potter logo on it, and I had a cloth mask that had, Captain America's logo on it. But again, because the purpose of those masks is to filter. Also used are thin membranes of cellulose acetate, polycarbonate, and plastics, where the pore size is carefully controlled. Charcoal, diatomaceous earth, and unglazed porcelain are also used. As I mentioned to those of you in my lecture a few days ago, porcelain, before it is glazed, water and fluids will pass right through porcelain. If you didn't glaze your potty in your house, you'd have a mess in your bathroom to clean up all the time. The pore sizes can be controlled to permit, I'll spit that word out in a minute, true sterilization by trapping viruses or large proteins. Places we're going to use filtration. It's used to prepare liquids that cannot withstand the heat, such as serum, blood products, vaccines, drugs, IV fluids, enzymes, and media. It is an alternative method for decontaminating milk and beer without altering the flavor. It is an important step in water purification. Anybody who buys bottled water can probably read on there and find out what type of filtration method is used on that water. It filters out particulate impurities such as crystals, fibers, and so on that can cause severe reactions in the body. Not just a filter is not only going to reduce the number of microbes, but it will also reduce the number of impurities that are there. If you've got a water sample and you're trying to make that water safe to drink, simply chlorinating that water, if there's sand, grit, and other things in the water, chlorinating is not going to do anything for that. That requires filtering. High efficiency particle air filters, or HEPA filters, are used in hospital rooms and sterile rooms, but keep in mind the ones used in hospital rooms and planes still have relatively large pores, so some microbes can pass through those. Osmotic pressure is the pressure exerted by standing water. If you add large amounts of salt or sugar to foods, it creates a hypertonic environment for bacteria, causing plasmolysis. The bacterial cells will rupture. Pickling, smoking, and drying foods has been used for centuries to preserve foods. And osmotic pressure is never a sterilizing technique. It simply prevents the bacteria that are there from reproducing. Again, you surround a large piece of meat with salt or sugar. It removes all the moisture. The bacteria on the surface can't grow. Then you cut that away. You've got raw meat underneath there. You cut that away. If you don't pack that back with sugar or salt, your bacteria will start to grow again, and you very quickly can lose that chunk of meat. All right. Let's stop here for a few moments, and I will pick back up after a while.